So another piece of equipment we've got is the pressure vest. And you can get these from a variety of different providers, and they come in different sizes from small all the way up to adult size. Now these pieces of equipment are very good for providing passive proprioception. So as we've talked about earlier, there's a difference between active and passive strategies. So we know that children engaging in active strategies, it's much better for their neuroplasticity and their ability to develop good coping strategies. That's not to say that passive strategies are no good. It's just that these sometimes are good for short periods of intervention, and it's essentially not teaching the child to develop good coping strategies when they're feeling anxious or they're feeling like they need a little bit of sensory input. So these vests should be, a child will need help with putting these on, so they're particularly good for school, perhaps with transition, perhaps encouraging them to go to assembly, for example, or it may be that a family might use them when the child is going into a hairdresser's and having their hair cut. The vest shouldn't be used for more than 15 to 20 minutes because the brain gets used to that sensory input and it starts to lose its effect. So it's really good for short bursts, for short activities, to help a child get used to some of these activities that they have previously found quite challenging. So you obviously want the child to cooperate with you. If they become distressed or they're particularly avoidant of wearing the vest, you shouldn't force it. You should listen to the child and try and introduce it to them in their own time. So some children might just want to have the vest with them and to be able to hold it and explore it in their own time before they're comfortable with putting it on. So we can pop it on here like we're doing with Sarah. And what we're looking for is the Velcro straps that are over the shoulders and around the waist. Now what we're going to do is, once we've got it on initially, we're then going to get hold of each of the straps and really pull it over the major joints of the body. So over the shoulders, like that, and then around here. So essentially, hopefully, the child feels like they're having a little bit of a hug or a squeeze, which you might find that they seek out that sort of input from you as a parent or as a teacher to help them feel calm, to help them calm them down if they've been upset or angry or are particularly worried about something. So this just gives them that little bit of independence. So this can be particularly good for some of the older children. So there we go. Does that feel nice? Yeah. Like a squeeze? Like a nice hug. Good. And like I said, you would only leave it on for no more than 20 minutes, and then you'd take that off. You'd encourage the child to take it off themselves if they're able to, so you're getting their participation and some independence. As with all of the pieces of equipment we've talked about so far, it's really important to look for signs of wear and tear. If there's any damage or if any of the seams are coming undone, then you should stop using the piece of equipment or the vest and either have it repaired or replace it. And in line with infection control, we should make sure that the vests are washed in between patient use, or if they're heavily soiled or dirty from anything in particular. Again, you know, the child should only have this on for about 20 minutes, but they should be supervised throughout the time they're wearing the vest.